Bill Gates recently spoke on the coronavirus, and he said that healthcare systems need to be strengthened, supporting low-income countries to build robust health systems capable of defending people against outbreaks. Cleveland Clinic is a global health system. How have you guys been reacting to the whole coronavirus situation?
So I think that's a great question. I think the first thing is we're lucky in that we have 66,000 caregivers worldwide. So we've got a lot of really, really smart people that are thinking about this. We also have a culture that is very open and sharing. So as we come up with solutions, we're happy to share them with as many people and as many organizations that want them. This is not a time to try to establish a competitive edge. That doesn't make sense. So when we started sensing that we would see cases in Florida, we immediately responded. So we have our mission control that meets every day, twice a day. That's just for Florida. We have a mission control with Cleveland as well. That is our global kind of mission control that meets every day, now twice a day. That is staying on top of things. We've been very public with what our capabilities are, with the fact that we're ready and willing to share with anyone, any healthcare provider that sends me a note or asks me a question. We'll give them anything we want, including pictures of how we're managing things here on our campuses, the signage that we have. Again, I think the key is transparency and openness and sharing best practices. This is not a time to try to establish yourself as being better than somebody else, because ultimately the world loses in that scenario. So I think that Bill Gates is right. It is true leaders lead by raising a tide, right? That's really what it is. I mean, a great leader doesn't distance themselves from everybody else. A great leader goes forward and brings everybody along with them. That's what I think the Cleveland Clinic is trying to do during times like this, during times of crisis. And I think we have some success in it, but there are just so many things going on right now around the world when it comes to coronavirus that it's clearly hard to kind of step forward and say we're the leaders, do exactly what we're doing, because again, it's rapidly evolving.
Exactly.
I don't know that anybody has all the right answers, but what we can do and what we should do and what we are doing is putting out to everybody what we're doing. And happy to learn from other organizations what they're doing, and I think symbiotically trying to come to the right conclusions on how to manage a situation like this.
And to everybody that's asking, what should you be doing, to stay healthy?
Yeah. So I would say a few things. Number one, if you're sick, if you have symptoms like the flu, self-quarantine. I mean, that really is important. Going to the grocery store or showing up to your doctor's office coughing all over the place is not the answer. You're only going to spread the disease. And even if it's not coronavirus, which to be clear, 99.9% of the time it's not, it might be the flu. It might be the common cold. You're still putting people at risk. So when you have those kinds of symptoms, especially now, try to manage with a self-quarantine. That's probably the best thing you can do. The second thing I would say is if you do feel like you need to be tested, go to an emergency department. Go to an emergency department where you can be tested in a secure area by healthcare providers that are appropriately gowned and gloved and covered. I wouldn't necessarily encourage people to go to their family doctor and not have the appropriate precautions, because again, you're putting all of those patients that are sitting in the waiting room at risk when you're doing that. You're putting your doctor at risk and your nurses at risk. And the worst case scenario is now we have to self-quarantine all of our healthcare providers. Right. So really kind of follow those kinds of directions. So if you come to our campus here in Weston, for example, we have a whole setup that is outside. And it's meant very specifically to protect our hospital patients and our hospital caregivers from somebody that could be positive. So we test them outside. If they're healthy, we send them home, tell them we'll self-quarantine. We will follow up with you with your test results, where this is all hand in hand with the Florida Department of Health. And I think that's a great step forward. If somebody needs to be hospitalized, they're in isolation rooms so that they're not at risk of passing the disease on to other folks. So again, I mean, hospitals are a safe place to be for a patient that needs to be in a hospital.
Exactly.
They're not a great place to be if you don't need to be in a hospital.
Awesome.
You know, that's the advice I would give folks.